We're now going to look at how to perform CPR on an infant. An infant is defined as a child under 1 year old. Cardiac arrest in this age group is very rare, but when it does happen, it's almost always caused by a breathing problem rather than a heart issue. Acting quickly with the correct technique gives the infant the best possible chance of survival. Before you do anything, make sure the area is safe. Look for hazards that could harm you or harm the infant. Approach calmly and speak to the infant gently. You're trying to get a reaction. Tap the sole of the foot or gently flick the bottom of the foot to check for a response. If there is no movement or sound, shout for help immediately. If someone is nearby, ask them to call 999 and leave their phone with you on speakerphone and bring an AED if one's available. If you're alone, call the EMS and put your phone on speakerphone and continue the initial assessment. The emergency call handler will give you step-by-step instructions and guide you through CPR if needed. Next, check if the baby is breathing normally. Gently place one hand on the forehead and 2 fingers under the bony part of the chin. Tilt the head just enough to open the airway, but be careful not to overextend an infant's neck, as it's flexible and it can block the airway if tilted too far back. Look inside the mouth for any visible obstruction and remove it only if you can see it clearly and easily remove it. Keep the airway open and look, listen and feel for normal breathing for up to 10 seconds. You're looking for the chest rising and falling. Listen for breathing sounds and feel for air on your cheek. If the baby is not breathing normally or only gasping, treat this as cardiac arrest. Because most infant arrests are caused by breathing problems, the first minute of CPR is critical in providing oxygen to the body. Rescue breaths are the first and most crucial step. Keep the airway open with a slight head tilt and chin lift to move it into the neutral position. Place your mouth over the infant's mouth and nose, making a complete seal. Blow gently for about 1 second, just enough to make the chest rise, and give 5 rescue breaths in total, watching the chest rise and fall each time. If the chest does not rise, recheck the airway position and seal and try again. After 5 rescue breaths, start chest compressions. Place your 2 thumbs, one on top of the other, on the center of the chest just below the nipple line. Wrap your hands around the infant's rib cage, supporting the back with your fingers. Push down about 1/3 the chest depth. Compress the chest at a rate of 100 to 120 times per minute, which is about 2 compressions a second. Allow the chest to rise fully between compressions to allow the heart to fill with blood. After the 5 initial breaths, continue CPR in a cycle of 15 compressions followed by 2 rescue breaths. Maintain a steady rhythm with minimal pauses. If another rescuer is available, swap every 2 minutes to prevent fatigue. When an AED arrives, switch it on immediately and follow the voice prompts. Use paediatric pads if available. Place 1 pad on the chest slightly to the child's left side and 1 pad between the shoulder blades on the back. If only adult pads are available, still use them. The AED will guide you on when to stand clear and when to resume CPR. Always resume compressions immediately after any shock, continuing until the AED reanalyzes or help arrives. Continue CPR until the infant starts breathing normally or shows signs of life such as movement or crying. Emergency services arrive and take over, or you become too exhausted to continue. If the baby starts breathing, place them in a recovery position for infants, laying on their side with the head supported slightly downwards to keep an airway clear, or in your arms in the same position. Continue to monitor their breathing closely until help arrives. Remember, the key points are: always check for dangers before approaching, call 999 early, give 5 gentle rescue breaths first, continue 15 compressions to 2 breaths at a rate of 100 to 120 per minute, use an AED as soon as available and follow the voice prompts, and finally, keep checking for normal breathing and signs of life.